announced that gut dwelling. Very soon we are going to talk about the healthy food and how to feed your children, because there are moms who think, and I'm among of them, that I am feeding my child healthy food and good one, and then I realized that I was making severe mistakes actually. So we are going to give hospitality to a pediatrician to tell us more about how to feed our children in a healthy way and in an attractive way as well, so that they can react with us and not hate us when it comes to food. Yeah. Sorry to cut you.
No, it's okay. So, in that regard, I don't think so. I don't think so that there's any certain type of diet except to follow a healthy, typical healthy diet for this child.
School enrollment.
The second thing, in fact, is for parents to seek, as we saw in the report the one before this report, last report, is to seek the early intervention, is to seek specialized centers that can give, especially prior to schooling time, such the center we have at King Saud University, to at least get more knowledge and know more about the resources, the community resources that can be used by the family in order to get the help that they need or to help their children. And since we moved to the preschool stage, the schools should be aware of the child case. The child should go through, I would say, multidisciplinary educational assessment.
Dr. Khaled, there are specialized schools in that, and they are a little bit expensive, and some people they can't afford it, and some people they go and enroll their children in some, I don't want to say ordinary schools, like private ones, but not that expensive, and they found when they enroll their kids there that they are mixed. Like the problem, we've heard this, that the normal children are there along with the autistic ones, and there is a sort of injustice actually, because the autistic children, they don't have the skills or the things that would enjoy them. What could it be?
The children with autism should not be isolated in separate places when it comes to education. They should be given the chance to access the general curriculum as any child, with the necessary accommodations, and as we saw in that case that has been presented.
What sort of accommodations should be there?
Well, again, I will go back to the example we heard in the last the report before the last one. For example, is to have a different form of communication. If the child has a problem in the verbal communication, like using the speech, then we can use
but you recommend
some kids with autism would use sign language, which is very surprising to many people. Sign language can be used for kids with deaf or hard of hearing.
And deaf,
but in some cases, sign language can be an effective form of communication, even if the receptive language is okay. But for them to communicate with others, if they have problem with verbal communication, that would be another, or using the, I would say, visual signs. And I should mention a very interesting example, and I got in fact the honor to interview her in one of my doctoral classes, Temple Gardner. She's a professor of animal science in Colorado State University, where I went to school in Colorado, and she was teaching in that university. And one of the assignments we had to do is to make interview with somebody with disability that made a significant, I would say, contribution to society. And I picked Temple, and I had an interview with her over the phone, and I was amazed by the ability that lady has, and the talent that she has. And she, by the way, she was diagnosed with MR, severe MR at the beginning of her life, but her parents were fighting for her to get some education. But she wrote a book, Thinking in Pictures. And she was talking about personal stories about herself and how she likes pictures.
To be educated.
Exactly.
Not
and they one of the
way.
characteristics, not all of them, but most of kids with autism, is that visual representation is a very effective
So you
for
recommend
them.
that for the plays as well, or the toys that moms would pick up for them, is to be colorful and more concentrating upon pictures?
Yes, since it's a developmental disabilities and the kids, they have problems in their developmental of brain.
Yeah.
One of the things that's it's hard for them to I would say comprehend abstract concepts. So having this visualized to them, to kids, to individuals with autism, it's very, very, very helpful. And
So
that's maybe mainly for educators,
Yeah,
is to
you
take this
recommended
into
that they should be
considerations, yeah.
mixed along with normal people in normal schools, and to eat healthy food. Normally, there is nothing or specialized for the condition of autism. And as well, when it comes to toys or things to enjoy them, please pick up or try to concentrate upon the colors and toys with pictures, because they will enjoy it more. We are having a last report in our episode for today about the campaign about autism, and the aim is to raise awareness about autism and about autistic children as well, and to deal with them in a very normal way, as they are normal people that could be with great contributions in the society when they are 30 or more years old. We'll be back in moments. Please stay tuned.
Can you introduce yourself?
My name is Majid Al Shaigi, member of Result Center in King Saud College.
Okay, could you talk to us about today's campaign?
Today is a good day, and because the first day start this one to learn or to tell people about autism, what it, because more people in Saudi Arabia and the Middle East don't know what it is autism. And for that reason, we include this copy, okay, to tell him how to we help the autism, and how to helping him for good, healthy for him, because he is as any boy, okay. He have this autism is disease, but we can make him as any boy. He need just something for his eat. We can giving him free gluten and free casein with the protocol done. This is in America. They have around 120 center for that one, and in Saudi Arabia this is one is the first center is support the autism boy.
Okay, we know that you have a child. He is autist. So could you talk to us about him, and does he get any benefit from the center?
My baby is Muhammad. Okay, I start.